I've got some. And I'm sure there are questions in the audience as well. I just want to say, for those of us who are at Rocket Pharma, it's such an honor to have you here, and it's hard to describe what this means for us, because we have our heads bent down and we're working, and this makes it worth it for us. So at the outset, we just want to say thank you for being willing to come here and share your story, Marley. Oh, I brought tissues for everybody else, but I think I'm going to need them.
Because of the confidentiality, I know the patients, but the Rocket group doesn't. They see her numbers, but they haven't seen her before. This is really a great day for them to have her here. They've all worked so hard to bring it through the FDA and make the trial happen. There's many, many moving parts to do the treatment that she got.
And we really appreciate it because, like I said, it was our hope and a prayer for a year, because I knew the bone marrow transplant was not the option for her. Like, I knew there had to be something else, and through all my research that I did, and I've done a lot of as a mom with something that when you're not diagnosed, and then when you're diagnosed, you want to find as much as possible about it. And I kept going back to, there used to be a gene therapy for LAD, and there wasn't anymore. And I'm like, there's got to be something. So it was just like this amazing gift when we were told that was, a possibility. Yes.
Marley, I had a question for you, if that's okay. So when we were trying to figure out schedules and plans, we heard that you had a Make-A-Wish trip.
Yes.
Can you tell us about your Make-A-Wish trip?
I went to Disney.
You did?
Yes.
I can tell from the smile on your face that it was a pretty good trip.
Yes.
So what'd you do while you were there?
I actually was a princess for a day, and then we went. I met lots of princesses too.
That sounds pretty fantastic. Can I ask you, Marley, one of the things I wonder about, what did you understand about what was happening? That's about right. That's how I feel on most days, too.
She knows more than she lets on, because I think through the whole process, she had to have a voice in it, too, and we've always let her have a voice. And do you want to, of course, with this part of it, we ask her, do you want to do a gene therapy? Because we don't know what will happen. So.
And that's a question actually for you, Don. How do you, as a PI, and obviously you're going to talk to the mom and the parents to get consent from them, but when you have a kid like Marley, how do you explain something like this?
I mean, Marley, as Mom said, she's smart. She understands. And so when we have our conferences, a lot of our phone conferences was just with the mom or the parents, but when she's with us and we talk about things, we try and include her in the discussion. And I think she gets most of it, right?
Yeah.
So I have one more question for you. So these two young women who spoke before, who had problems, I don't know if it meant anything to see, how they've grown up to be ladies, who, and you're not quite there. What do you think about that?
It makes me happy.
Oh, yeah.
And just to kind of go off that, we didn't have any, not knowing what she had for so long, and then when we found out she had LAD, and it being so rare, we didn't have any outlet, like anyone to talk to or to get tips from. The doctor we've seen in Miami, he was the first one that told us, she should be on a special diet, and she shouldn't do this and that, and she had to wear an N95 mask. So to see these other ladies and to know that there's a group of people that, are in your community that you can reach out to and share the same, lifestyle, I guess, like this, you've been through it all. So it is very heartwarming to know.
And I know, it's a big ask to ask families to be in a gene therapy trial. It's a real big ask, and I know certainly from our perspective, we try really hard to think about what could we do to make it easier, make your life a little bit better. And I know Dr. Cohn and his staff, that's foremost, how do we make you comfortable while you're going through this? What worked? What more could we do to make this a better experience?
I think everything, y'all have taken well care of us. When we were inpatient, I was able to stay with her the whole time, which I've never left her side at any time that she's been hospitalized. And she was spoiled as usual. So I can't think of anything that, that could be added that y'all haven't already done.
We did not plant that answer.